Hello, everyone. Thanks so much for joining us today on what we will hope will be a stimulating and thought-provoking webinar. My name is Hallie Preskill, and I am a Managing Director at FSG, based in Seattle. I have the pleasure of moderating this webinar in addition to presenting some of the findings from our research on early learning indicators for children ages 0 to 8. Before we get started, however, I'd like to note a few housekeeping things. We are hoping to have 20 minutes for questions and answers at the end of the webinar, so please feel free to submit your questions or comments in the chat box. And at the current time, you're the only one who will be able to see your question, but we will be culling them and collecting them and trying to address them at the question and answer period as best possible. I also wanted to let you know if you're experiencing any technical difficulties, please write a note in your chat box and we'll do our best to address your issue. And then third, the slides that we are presenting today will be available after the webinar on the FSG website within about 24 hours or 48 at the most. So let's go ahead and get started. Next slide, please. As you can see, we have a fairly packed agenda today. We're going to start with my sharing some information about the research we conducted that was generously funded by the W.K. Kellogg Foundation that focused on synthesizing and vetting a set of early learning indicators. We will then hear from Dr. Kyle Snow, an expert in the early learning field, who will comment on what we found in our research. Following Dr. Snow, two expert practitioners, Linda Sullivan Dudzik and Donna Friedman, will talk about how they are using indicators to guide the support and development of young children within their communities. And if all goes according to plan, we'll have about the 20 minutes for questions and answers with our panelists. Next slide, please. If there ever were a time to focus on the lives of young children, it is now. It's quite likely that we are perched on one of the most important tipping points when it comes to understanding the needs of children from birth to age 8. We think this tipping point is supported by several developments. First is the increased attention on early learning. And we are learning that, among other things, the quality of the brain architecture is determined early and lays the foundation for the lifetime of brain development that follows. One little tidbit of information, 700 neural connections are made every second in children in the ages of 0 to 3. And in his 2013 State of the Union address, President Obama emphasized the connection between early learning and success later in life, calling for universal, high-quality preschool for all children. In addition to the attention that's growing around early learning and the importance of supporting young children is the country's changing demographics. Families across the United States have been hard hit by the economic downturn in recent years, as we all know, and as a result, more children, unfortunately, are living in poverty. In 2009, 55% of all children in the U.S. were non-Hispanic white. Today, however, a majority of babies born are children of color, and by 2030, more than half of all of the children will be of color. And the third particular aspect of why the time is now is around the early childhood learning field in particular. It too has been evolving in the last few years. In the midst of the field's complexity and historical fragmentation, we are increasingly seeing a variety of collaborations take hold, collaborations that are embracing a systems view of early learning development and education. And these collaborations are helping form some general agreement on the early foundations of knowledge that includes developmental domains, which reflects a shift from academic development to whole child development for school readiness. And birth to 8 lays the foundation for cradle career success and the critical development of the brain during the 0 to 3 lifetime. And finally, the whole child development, an understanding that it takes place in systems that include the child, families, school, care centers, community, and not just in school or in the home. Next slide, please. With generous support from the Kellogg Foundation, FSG set out to identify and vet a set of early learning, ages 0 to 8, indicators that could be used to start a conversation among practitioners and researchers, families, care providers, and others that would address issues of whole system alignment, race equity, and the use of indicators to make a difference in the lives of young children. We interviewed 40 early childhood education experts and reviewed more than 1,100 indicators from 11 sets of nationally used indicators. In particular, we identify indicators of successful child development and well-being, factors surrounding the child that contribute to their success, and relevant policy and research trends. We focus specifically on sets of indicators, including assessment tools, developed under prior initiatives or highlighted in interviews by our experts. And we collected and reviewed more than 100 documents from the fields of child care, childhood development, education, health, literacy, and multicultural studies. From all of this, we developed a list of 62 indicators that reflected the early childhood ecosystem ages 0 to 8. And with regard to race and equity in particular, we discovered that many national indicator sets do not yet reflect race and equity, and that there is research, fortunately, underway to address this gap, but it is still emerging. Therefore, you'll note on the slides that follow that we've identified several emerging themes that suggest indicators that need to be further developed, vetted, and researched. Such indicators include cultural competence of care centers and staff and their approaches to teaching and learning with children potentially from different backgrounds. They also include awareness of a child's definition of self, behavioral norms, and cultural expectations around behavior and obedience as a direct input into a child's development. After vetting a preliminary list of 62 indicators with more than 24 experts, we landed on 48 indicators that address a wide range of needs and supports for young children. These indicators and examples and recommendations for using them will be included in our final report, which will be released this summer. While we don't have time to go into all the indicators on this webinar, we will include the full set in the slides that will be posted on the FSG website in the next 1 to 2 days. As you can see on this slide, the framework that guided our thinking and process of indicator selection is shown here. In the nested circles are the different layers of the early childhood system, which are borrowed from Bronfenbrenner's ecological model of development. We also attempted to capture indicators that relate to the 5 developmental domains of early childhood development. This includes domains of development beyond cognitive and literacy development to socio-emotional and physical development, as well as approaches to learning. From our research, we learned that perhaps not too surprisingly, many organizations are committed to serving the needs and development of children ages 0 to 8. While the actors in the early childhood system reflect multiple sectors and are quite diverse, we found that there are significant efforts afoot to coordinate, collaborate, and align their efforts in the hopes of developing a common language, common framework, and common goals. As I mentioned earlier, we are hoping that the 48 indicators presented in our report that reflect the 5 domains of development, the different layers of early learning ecosystem, and reflect a race and equity lens will spur further dialogue and collaboration among these diverse sets of actors. In the next few slides, I'll briefly share some of the indicators to give you a sense of the types of learning that are so critical to young children's healthy development. We note in the dark shaded boxes on these slides those indicators that have been researched, validated, and used by others. In the dotted, lighter boxes are indicators we've identified as emerging themes. Again, those are indicators that are being and developed and not yet on various sets of indicator lists. So on this slide are a few of the whole child development indicators. And of the 48, 18 indicators are in this category and with one emerging theme. These indicators include things like common measures of physical development and early literacy. They also include socio-emotional indicators such as behavior management and knowledge of self, including racial identity and social class. And you can see that children's inclusive behaviors of others is a key emerging indicator. On this slide are some examples of indicators relating to the role of families in the lives of young children. In our report, we include 9 indicators and 3 emerging themes. Indicators of families reflect the key areas of maternal, parent, or guardian well-being, family, socioeconomic level, parenting practices, and family structure. The indicators on this slide illustrate a few that reflect the role of schools and care centers. And here we identified 17 indicators and 3 emerging themes. These 3 indicators focus on child care programs, care centers, schools, and family and friends, and neighborhood care that reflect the key areas of physical environment, workforce characteristics, and care provider or teacher-child interaction. Finally, on this slide are examples of indicators related to the role of communities and neighborhoods in supporting children ages 0 to 8. In our report, we describe 4 indicators and 3 emerging themes. These indicators include the resources and institutions found locally and the conditions that describe those resources and institutions available to children and their families. Again, I'm sure many of you are wondering about the full set of indicators. Again, these will be part of the set of slides in the next 1 to 2 days on our website. So some of you may be asking yourself, if there are so many indicators out there, why do we need one more set of indicators? It's a fair question. While it's true there are thousands and thousands of early learning indicators out there, it is becoming increasingly confusing about where to focus our early learning efforts. So FSG's work was really an attempt to not only bring some kind of synthesis and order to these indicators, but more importantly, to offer a set of indicators that reflected the whole child's development, that were grounded in a systems framework, and that addressed race and equity to the extent possible. Next slide, please. To comment on this effort that FSG undertook, we've asked Dr. Kyle Snow, Senior Scholar and Director of the Center for Applied Research at the National Association for the Education of Young Children, to share some of his thoughts. In his position, Dr. Snow is responsible for ensuring that NAEYC positions and procedures are research-based, and he provides scientific leadership for the organization. Prior to joining NAEYC in 2010, Dr. Snow was a senior research psychologist at Research Triangle International, where he was a principal investigator for the Early Childhood Longitudinal Study, Birth Cohort Study. His areas of specialization include infant and child development, early childhood assessment, and factors affecting children's early care and education experiences and their transition to school, especially the experiences of dual language learners. Dr. Snow is co-editor and contributing author of the book School Readiness, Early Learning, and the Transition to Kindergarten in the Era of Accountability. He has served on numerous federal, state, and private advisory panels and is a Research Connections Fellow. Dr. Snow?
Thank you, Hallie, for inviting me to share some reactions to this important work that FSG has been doing. And before I give those comments, if we can go to the next slide in our sequence, I want to start by providing a frame of reference for my comments. And I start by talking about my professional home, which is at the National Association for the Education of Young Children. NAYC is the nation's leading voice for high-quality early childhood education for children birth through age 8. Within NAYC, I direct the Center for Applied Research. The mission of the center is to focus really on ensuring that research and data are part of the conversation along with practice and policy to support high-quality early childhood education programs. Our vision is that this is a sort of three-legged stool model where research and data and practical knowledge from the field, as well as an understanding of policies affecting early childhood, all are part of the conversation to ensure high quality for children. Within the NAYC broad view are several specific points that are related specifically to indicators and assessment that I'll mention just really briefly. The first, and really a hallmark of NAYC's position on developmentally appropriate practice, is a focus on multiple domains of child development, so-called whole child development. Second is NAYC promotes program standards that capture a breadth of quality indicators for programs serving young children. Third is a real reflection and recognition of the value and importance of cultural diversity for children and programs serving the young children. And finally, for the context of this reaction to the indicators, is a focus on equity of opportunity for all children. Now, within this sort of broad organizational frame, I also bring my own training and background as a child developmental psychologist, coming from a bioecological model, the so-called Bronfenbrenner model of child development. So the indicators in the overview that was provided earlier really captures this sense that children are developing within a context of programs and communities and neighborhoods and families, and all are playing a role in the lives of young children. Next slide, please. As was alluded to at the beginning of our session today, there's a great deal of energy and effort and activity going on in early childhood. So I want to hit on a couple of elements that are sort of critical, I think, to thinking about the potential value that this work and indicators can contribute. First is that in the policy realm, there are just many federal and state policy initiatives that are related to early childhood. Of course, at the federal level, we have the President's proposal for expansion of access to universal pre-K models. We have states following suit by expanding their pre-K programs as well. In addition to existing at federal and state levels, this work on early childhood development emanates out of multiple branches of both state and federal government. So we have a very complex policy realm to work within that provides some challenges, but also, to me, more importantly, great opportunities for us to really drive systems of development for programs to support young children. I'd also note, just related to policy, that although there are many indicators of child well-being that we talk about here in the United States, really a lot of the, to me, fascinating work on indicators of child well-being show up in the international space, either through OECD or some of the work coming out of Canada and other places that really takes a very similar approach that's taken here, as I'll allude to later on in my comments, of looking at the full space in which children develop. Now, in addition to these policy spaces, there are some, I think, important ideas that are emanating out of the early childhood field, in the United States anyway. And the first is a real strong focus on child outcomes and a very related focus on programmatic quality. Now, in many cases, these two ideas are connected in a linear kind of unidimensional model, the idea being that high quality drives positive child outcomes. And I would suggest that this is a very simplistic model, and it suggests that there is a singular driver of child outcomes, not multiple, as we'll talk about in a moment. Now, one of the great things about indicators generally, and the indicator work being undertaken here, is that they highlight a common set of benchmarks that can be used at scale. And by at scale, I mean at national, international, and even across communities within state and localities. These benchmarks can be used at scale, and when they're well designed, they can provide a broad assessment of how well we are meeting the needs of young children. If I can go to the next slide, please. So the ability to, have this conversation about benchmarks and are we meeting the needs of young children is, of course, quite important. Let me underscore a couple of points about why this work, I think, in particular, matters so much. And I'll break my comments into two pieces. The first is the process, and the second is the resultant product. The process undertaken that Hallie described very briefly, and that she'll be able to read about, I suspect, in more detail in the report, is one which was both inclusive and rigorous. So following a model of an extensive review of the research literature and expert review and feedback from experts from multiple disciplines and multiple backgrounds really results in about as well-informed an indicator set as one might hope for. And in the context of trying to develop an indicator set that really speaks to issues of equity and diversity, this kind of process is really not only advantageous but virtually a necessary ingredient to ensure that the indicators we come up with are appropriate and valuable. Now, this process, as I noted, led to what I think is an extremely relevant product, and I want to make a couple of comments about the outcome of this work. The first is that, as Hallie indicated, we end up being able to put a systematic lens or a systems lens on child development. So the indicators reflect layers of early childhood development ecosystems, including families, early childhood and early elementary school educators, communities, and so on, that exist in the lives of young children and their families during the children's age from birth to age 8. And the second piece of the systems lens is its focus on the whole child, not a specific focus on any individual element like child literacy or even child health, but on the totality of child development. The indicator sets do include indicators related to racial and cultural disparities, which of course is important for us to be able to measure to see and monitor our progress in actually addressing disparities. these indicators then create targets of action for change across systems. So if the target of action is to reduce disparities, we can, through our indicator work, identify how broad the disparity is. But by cutting across systems in the indicator work, we can identify potential sources or channels of action for affecting change. And finally, the indicators take a really interesting and important tact that's not typical in the work that sometimes occurs in early childhood. And that is to say that the indicators that we've talked about and that we'll be launching highlight the importance of starting with what you want to know. You know, what are the things that we want to know about how children are doing, not what we simply can measure. Too often in early childhood, we start with what we can measure and go from there rather than thinking about what we should be measuring and develop ways of moving that work forward. So the net result is, to me, this wonderfully inclusive process. And in early childhood education, we're all about in being very inclusive of multiple viewpoints. But I think the result of that process shows up in the product in terms of being able to give a broad view of early childhood development, which results in a broad range of indicators that can tell us about the well-being of young children. So as far as the value for these early learning indicators, well, it comes about to me very clearly through this process. If I can have the next slide, please. By developing these indicators and supporting their use in communities and within systems, we're able to provide a common language for describing the development of young children. So we all have an agreed-upon language that we can talk about, and giving us this common language gives us a better platform for collaboration. If we all agree on what it is we're trying to do, we can, that is, we're all on the same page, we can then be more thoughtful and provocative and efficient in collaborating to achieve a given goal, a given change at an indicator level. And this, of course, does enable us to align systems, align actors and agents of change across systems, again, attempting to harness the realities of how children develop within multiple contexts to act within all of those contexts to affect positive change for young children. So again, I'm excited to see these indicators launched and excited to hear about how they're being played out in the community. Thank you very much for the chance to respond.
Thank you, Kyle, so much. We really, truly appreciate your reflections on this work. To illustrate the use of indicators, to show just how the indicators can be best used to support the development of healthy young children, we've invited two expert practitioners to share their work. We are very appreciative of their participation in this webinar, and I think you're going to find them really to be quite inspirational. Next slide, please. We will hear first from Linda Sullivan Dudzik. Linda currently works as Director of Special Programs in the Bremerton School District in Bremerton, Washington. A nationally recognized speaker, educator, author, and educational consultant in the area of pre-K-3 grade systems, Linda has over 30 years of experience in public education. The Bremerton School District has been acknowledged nationwide for work with their community preschools and the development of an aligned pre-K-3 system. Linda co-authored the book, Making a Difference, 10 Essential Steps to Building a Pre-K-3 System, with Donna Guerins and Kelly Lavelle. Linda and her colleagues work with numerous school systems and states across the nation to build sustainable, aligned P3 systems. Linda?
Thank you. It's a pleasure to be here and quite the honor to be highlighted for Bremerton School District. Next slide, please. Bremerton is a rather small community. You can see I won't read the slides to you. And what we struggle with is our poverty and also with our high rate of special education students. Both of those things we see as a strength-based, wonderful asset for our community if we're able to engage our entire community on this work. So what I love about Bremerton is for years and years the community has rallied around their children. However, without looking at any kind of indicators, we had a false sense of security. We thought we were doing pretty well. with our children, thought they were doing relatively well in achievement, until when we received Initiative 728 funds, it required outcomes and measurements. And so for the first time, we looked at our literacy skills for children arriving in kindergarten, and were quite shocked and alarmed, as we should be, with only 4% of our children entering kindergarten with those early literacy foundation skills. And so rather than playing the blame game, we brought our community together and we looked deeper into that data. Who are these children that are coming to our school district? Where are they before kindergarten? What are all the positive efforts that are already being done in our community? And what can we do together to have more children having a stronger foundation skills, to wrap our support system around our families, and to continue that support and achievement kindergarten through third grade and beyond. What we ended up doing is, next slide please, is we gathered together with our community partners, faith-based, families, wherever children were at prior to kindergarten, and invited us all to work as a team and to look at the research on how young children learn and what are some things that we can do together to support our families and our children. Next slide, please. So when we looked at this, we formed a P3 leadership team. Oh, I'm sorry, I advanced too fast. We formed a P3 leadership team, and we actually used these indicators to develop a partnership. Then this group meets monthly, and there's equal representation from the school district and our community partners. And we look at how we are doing. We plan our professional development based on the indicators. We expanded our outreach when we discovered that there were a large percentage of children that were not in any kind of preschool or birth to 3 program. And so that helped our organization meet with the community and establish some outreach groups. It allowed us to establish a common language. We all in our community preschools share monthly professional development. We share a common curriculum. And then we established an assessment loop, birth up to third grade, where preschool shares with kindergarten, kindergarten shares with preschool, kindergarten and first grade exchange information, first and second, second to third, so that we can celebrate and build on our success as well as revise our instruction. Next slide, please. This has been an incredible success for Bremerton, for families, for children, for teachers. In doing this support system, we've seen increases in our students with disabilities, significant increases. In the area of literacy, we have increased from 4% to 52 and 63% of our children coming into kindergarten with early literacy foundation skills. Based on that success, we added social and emotional goals, and we added math goals that we could measure and celebrate. And then what I'm most proud of for our community is this third grade closing the achievement gap. 2 of our P5 and P3 schools have received the Washington State Award for closing the achievement gap from low-income students to higher income students. And to think that by working together, we can actually close that gap and do more for children, it's been wonderful, just the possibilities for these children's lives and their families. I think
Wonderful.
my time
Thank
is
you,
up.
Linda. You did great. You're right on time. Thank you so much. And we also have some questions coming in for you about your presentation. So when we get to the question and answer, we'll come back to you on some of those questions. Thank you so much for sharing the Bremerton experience, and it's pretty impressive what you've been able to accomplish. So now we have the pleasure of hearing from Donna Friedman, who is a 2007 Fulbright Scholar and is the director of the Center for Social Policy and is an associate professor at the University of Massachusetts Boston's McCormick Graduate School. Since 1998, Dr. Friedman has led the Center for Social Policy's team in its research and evaluation work in Massachusetts and in the U.S. Throughout her career, Dr. Friedman has been engaged in the management and delivery of human services, including early intervention. Her research and policy work are focused on homelessness and its prevention, as well as evaluation of government, philanthropic, and NGO social policy innovations. Dr. Friedman is the author of Parenting in Public, Family, Shelter, and Public Assistance, a book that bears witness to and draws lessons from mothers, staff members, and directors' experiences related to family support and the care of preschoolers in congregate family shelters. Currently, she leads the UMass Boston team, which includes Mary Coonan, Alice Carter, and Ann Douglas, in their evaluation of Thrive in 5, an initiative of the City of Boston and United Way of Massachusetts Bay. Donna, it's up to you. Over to you.
Thank you, Hallie. I'm very pleased to be on this webinar on behalf of Thrive in 5. First slide, please. Boston is a diverse, vibrant community that has become a majority-minority city. 53% of Boston residents are people of color. However, economic and racial disparities hinder the realization of children's potential. Over 38,000 children, 5 and younger, live in the city, and 27% of these children live below the federal poverty line. In 2008, cognizant of persistent academic achievement gaps, especially for low-income and children of color in the city, the mayor and the United Way of Massachusetts Bay issued a school readiness call for action. 65 community leaders representing all of the systems and sectors that touch the lives of these children engaged in a school readiness action planning effort, creating a school readiness roadmap which identified a set of ambitious goals, strategies, and success indicators for change. Thrive in 5, Boston's promise to its children, became the backbone organization leading this citywide initiative. Next slide, please. The Thrive in 5 goal, established by broad consensus, is for 100% of Boston's children to be ready for school success upon kindergarten entry by 2018. 5 communities with strong existing networks and high concentrations of young children in low-resourced families, least connected to early childhood and family services and supports, were selected to be pioneers of the initiative called Boston Children Thrive. In each neighborhood, a hub agency brings local partners to a school readiness roundtable to create and implement an aligned neighborhood network of resources and supports for families and caregivers to advance children's development. Now, in its 3rd year of implementation, connections with priority families and informal caregivers are taking place, largely through outreach by a cadre of culturally and linguistically diverse parent partners. A membership model has evolved with use of a membership card that has a barcode for each adult caregiver and child. The card is scanned when parents participate in planned activities. Incentives that appeal to parents are being built into their use of the card. In those communities furthest along, enrollment has come to symbolize a sense of belonging and participation in a citywide campaign to support children's development. Family-level enrollment data collected prior to issuance of the membership card are being used in the evaluation which I and my teammates are conducting and is serving as a foundation for our plan over the next 3 years to link household-level data to child and family participation in activities by intensity and activity type, to developmental gains for children and changes in social connectedness and parental efficacy of their parents and adult caregivers. These are indicators that really matter to the Thrive in 5 stakeholders. Evaluation was built in from the start. Using a real-time evaluation approach, we generate quarterly reports synthesizing each neighborhood's enrollment results and implementation strategies, documenting progress relative to targets set by each community with a Thrive in 5 central team. Results have been used to change strategy. For example, we generate maps of active family enrollments across each neighborhood. One community's enrollment map showed that all of its enrollments were concentrated in one corner of the neighborhood with none in the housing development on the other side of the neighborhood. Seeing this evidence led to a reorienting of the community's outreach strategies. Next slide, please. So what do we know about results thus far? In terms of reach, 3,343 primary caregivers are enrolled, which is 206% of a 15-month target. 85 informal caregivers are enrolled, a little less than expected, 80% of a 15-month target. A parent leadership pathway has evolved in which parents progress from volunteer roles to stipended roles that include peer-to-peer outreach to families and other caregivers, and to roles as leaders of change efforts at the city and neighborhood levels. Moving forward, these 5 neighborhoods, serving as the foundation for testing and refining core Thrive in 5 engagement strategies, are now positioned to embark upon Thrive in 5's next efforts to integrate and collaborate with major systems that touch the lives of young children, their families, and informal caregivers, that is, the early education and care as well as healthcare systems. First, universal screenings of 2- and 4-year-olds in the 5 neighborhoods are beginning, and they're being carried out by early education and care providers, trained parents, and pediatric providers. Secondly, quality improvements for early education and care settings are being undertaken. These settings in the 5 neighborhoods will receive support from Thrive in 5 to make program improvements in quality domains integral to the state's quality rating and improvement system. Documenting impacts of all of these interventions on children and families will be the work of the evaluation team, as I indicated earlier. Thank you so much for your interest and your attention.
Thank you, Donna, very much. The project is highly complex, and we know you could only tap a part of it today on today's webinar, so thank you. It's very exciting to see the work that you're doing. Next slide, please. So we are wonderfully fortunate that our panelists stayed to their time, and we actually have the 20 minutes that we had hoped for Q&A. So this brings us to that part of our webinar, and during the presentations, we've actually received a number of questions from you, the listeners. We've been organizing them, and I'll be asking the different panelists to respond to hopefully a few of the questions that you've asked. But I do want to start with saying that a number of questions, certainly early on in the presentation, asked about where are the indicators, when can we get them, when's the report. So just want to say that a couple of things. The indicators, the full set of the 48 indicators will be attached to this slide deck that you're seeing today and be put up on our website within the next 24 to 48 hours. So the slides exactly as you see them here, and then we'll have the list of the 48 indicators as a set of new slides. Again, 24 to 48 hours on the FSG website. In terms of the report itself, we don't have a publication date at this moment, but the goal is this summer, and certainly we hope sooner is better. So if you will just stay tuned, and we'll hopefully, you'll see some communications, or certainly could check the FSG website, but we will be coordinating that with the Kellogg Foundation, and it will be coming out. Also wanted to mention that you will have access to the recording and the slides from today's webinar. So not only the slides, but the recording as well, if you wanted to listen to it again or check out the slides again. So that will be, again, available within 24, 48 hours. Okay, so let's get to the meat, the substance of your questions. Let's see. Let's take the first one for Linda. And Linda, one of the participants asked, can you explain how you reached out to those not in preschool, but also asked about the indicators themselves, how you used the indicators, and then once the indicators were agreed upon, how did you get consensus around, let's see if I get the best number, across constituents on the best tool for measurement, when there was a variety of options about which measurement tool to use. So basically, how did you measure them, but more importantly, or as importantly, how did you use what you learned from those measurement tools?
Sure. I'll start with the outreach to children not in preschool. Was that the first part of the question? Or just the outreach to all children?
It was, I think the question was not in the preschool.
Okay, so
Yeah,
the outreach
not
to
yet.
not in preschool, one thing that has been successful for us is when children register for kindergarten, we ask parents where were their child prior to entering kindergarten. And our expectation is that all our principals are P5, P8 principals, and that they reach out to the community that feeds into their school. And so we found out on the registration and from our principals that there is a large percentage of families that don't have their children in preschool. And so then we opened up an evening and a during the day at our Naval Avenue Early Learning Center and invited all parents and grandparents to come in for a discussion and learning about child development and offering some ideas to do at home with their children to build some of these skills. And we offered materials as well. So that was the part about the outreach. The outcomes, we started with one measure, and it was the preschool community. That when we started at the end of preschool measuring kids coming into kindergarten, they asked that we work with them to assess children early enough to where they can do something about it. And because we used a strength-based approach and because of our P3 leadership team where people are valued and respected and have equal distributed power, I think that made people feel comfortable enough to have these discussions and to agree on a couple indicators.
Wonderful. Thank you very much. Next one is for Kyle and Dr. Snow. This person asks, how can cultural diversity be used as a resource for the development of a child rather than a disadvantage, given the mostly adopted Western cultures in measuring the school readiness of children? And how would this be measured?
Well, that's a great question. And I always think questions I can't really answer are better than questions that I can answer. It's really a multiple-part question. I think I mentioned in my comments that the perspective of diversity and cultural competence is really a central view of NAEYC, and it's in that context that it's viewed as a strength and as an asset. And I think getting to that point is one part of the answer to this particular question. So we do typically, especially in the United States, see diversity as an indicator of disparity. So we talk about the school readiness gap or the achievement gap and so on, where there is a advantage and a disadvantage side, and we tend to put the disadvantage side as coming from some kind of diversity, typically racial or ethnic, but also linguistic or income. So the first thing I would say is turning in a very real way, not just in the words that we're using, but thinking of cultural diversity as an asset rather than a potential negative. That being said, cultural diversity is, it's a great question how one would measure cultural diversity. I think in the context of this question, it's how do we know or how do we think about children's appreciation for cultural diversity or systems capacity to provide for opportunities for children to learn about cultural diversity and to appreciate other cultures. And I know that there are a number of research projects going on, as well as just projects arising up from the early childhood field, trying to come up with ways of measuring these things. I don't know that any have particularly risen to the forefront at this moment, but I'm hopeful and I'm optimistic that we'll be able to get there very, very soon. As I said, in the early childhood community, we oftentimes have been driven by what we can measure, and this is a case where what we think is really important is not something that we yet know how to measure, so we're working on it.
Thank you very much. And I just want to add that, we talked to several professionals who are working in, especially around these emerging themes around race and equity. For example, we talked with folks from the National Council of La Raza and we talked with folks from the Coalition of Schools Educating Boys of Color and others. And what we learned was that the indicators haven't quite settled on the definitions and the specific indicators yet, but that research is ongoing, and that they were going to be coming out with some documents around various outcomes and indicators that really address some of the racial equity diversity issues around children 0 to 8. I think where we landed, that is FSG, is when we looked at these different kinds of indicators and brought that race and equity lens to the work. We believe that has to be defined in the cultural context of the community. That indicators really are only good in terms of their usefulness in that community. And while, yes, as Dr. Snow, mentioned that we can lift those up and use them at scale, across communities, states, and nationally, the aspect of measurement and aspect of really understanding the issue or lens of race and equity needs to be interpreted and operationalized within the community context. So when it comes to measurement, we believe that it's not about choosing let's look at the tools out there and let's just pick one that we think works. It really is about determining what are the indicators that are relevant and useful, meaningful for this community with this population or populations, and then either adapting an instrument or developing one that will meet the specific needs of children in that community. So that was my little soapbox. Yeah, please do.
One thing to that? Because I think it's a real nice illustration of your point. And one thing that we find oftentimes, for example, is there is often a bias towards a majority viewpoint in how we think about indicators. And so you mentioned Council of La Raza. We oftentimes think of children making progress in academics or in school within an English language context. And so our indicators tend to indicate a particular language direction rather than the notion of, as you were saying, able to communicate effectively in a language which is dominant in their community. So, giving recognition to the dual language community that there is value in having indicators not only of English language acquisition, but also use of their native language or home language as having value within the community as well.
Great. Thank you for adding that. Well, we could talk about this one for a long time, but we also want to hear from Donna, Dr. Friedman, who has a question. We have a question for her as well. Donna, someone asked, tell us more about the card that parents scan that tracks their participation in Boston's Thrive in 5 programming. What types of incentives are offered to parents?
Well, they vary across community, and in one community that is furthest along on this initiative, they have actually developed a kind of point system for participation in various kinds of activities, play groups, all of the kind of events and activities that are being set up in that community across organizations to support children and their caregivers. And participation leads to a certain number of points. This same community has actually, provides points to families for reading to their children. And all of the 5 communities are figuring out about the kinds of incentives that would be associated with points. So they're using this approach to talk with businesses about discounts on certain kinds of things that families can purchase in various kinds of stores in their communities, access to events that would be fun family events or places that are fun places to take children are the kinds of incentives that are being developed at this point. And there is a sense that it would be useful to develop a sort of citywide approach to these incentives. But it turns out that, having the card and getting points, especially in the communities that are furthest along, just is associated with excitement for families who participate. It isn't actually necessarily the value of whatever the incentive is. It's having a sense of belonging to a campaign and knowing that what the parents and caregivers are doing is good for kids.
Great. Thank you very much, Donna. The next question actually is for Linda and Donna, and this comes from someone who wants to know, what are the assessment tools that are used for the kindergarten early literacy readiness in Washington, and what is the screen used with 2- and 5-year-olds in Boston? Which one would like to field that first?
Well, I'm happy to speak. This is Donna. Here in Boston, the communities are using the ASQ for the 2- and 4-year-old screenings.
Okay, and then for assessments for, you said kindergarten readiness. In the area of literacy, we use a combination of both on-demand assessments and more of an authentic assessment. So in Washington State, we have what's called the WA kids, and our kids are coming in at the 80% foundation skills in literacy. And we exchange information from the Head Start's Teaching Strategies Gold and connect that to the kindergarten teachers. And then for on-demand assessment, which gives us a glimpse at how children are processing information so that we can intervene before children need special education, is that we use the Get It, Gotta Go for preschool and the Dibbles and Easy CBM coming in. We don't rely certainly on just those assessments, then we dig deeper, but it gives us a percentage of children that we need to provide more practice opportunities for.
Great, thank you. There was a question here that, there are 2 questions, this is Hallie, that I want to address, and this has to do with race equity, and I think it's fair, and I want to address it. Someone writes, the focus on race equity is great, but none of the panelists appear to be people of color. How involved were people of color in the development of these indicators, and are they widely embraced by communities of color? Fair question. You're right. The panelists, as far as I know, are mostly not people of color. But I do want to say that the team, the FSD team that worked on this, 4 of the 6 were people of color. In terms of have communities of color embrace this, we have not released this yet, but we're hoping they find value in the work and that they'll also contribute, continue to contribute indicators of early learning 0 to 8 that actually have a race equity lens to them. The other question, this kind of relates to it, is, someone asked, what do the participating partners hope will become of the new set of indicators? And this is a great question. What attracted us to this, what attracted FSG to this work is that the Kellogg Foundation didn't want necessarily just to come up with an indicators for a set of indicators, like, okay, here they are, and go and be merry. They really wanted to use these indicators, whatever work we came up with, whatever set, to start the dialogue, to start bringing people together, to collaborate, to reflect on, to engage in cooperatives and collaboratives around how to use these indicators to make a difference in the lives of children. And so they were very clear in saying that, this hopefully to make some sense. Part of this work was sense-making, given the thousands of indicators out there. And even since we posted the note for this webinar, we've received many emails from people sending us their indicators and different assessment tools that they've been using. And so there's clearly a lot of work going on in this field, and I think the foundation wanted us to kind of synthesize and make sense of some key set of indicators with the racial equity lens, with the whole systems and 5 domains lens overlay as well, as a way to start thinking about how can we come together with a common language, perhaps a common framework, to do this work, and particularly within a local community context we think is the most value. So, we hope that the webinar today actually, gets you starting to maybe reach out to other people, to take a look at the the full set of indicators when they come out on the web in the next day or two, when you have a chance to read the report, and to have conversations in your communities around the meaning of these indicators. But then, how can we best use them? How can we actually adapt them, if necessary, to our local context, and actually, be very tailored and specific about how we measure them? So I hope that helps address the question. I think we might have time. It's 3:26. Maybe one quick one for Kyle. With all the brain, and maybe 2 minutes, Kyle. With all the brain research in the last decade, how has the research changed the indicators? Good question.
That is a good question, and the very short answer is I think the indicators are now looking at identifying those things around children that we know have a greater impact on brain development. So the work out of the Harvard Center for Developing Child on the effects of neurotoxins on brain development during the early years, the effects of stress and stress responses on brain development are two examples of kind of recent brain research that I think are starting to show up, and indicators that look at environmental toxicology, as well as community and neighborhood and family stress. So that's less than 2 minutes.
Perfect. Thanks so much. Well, that does bring us to the end of the webinar today, and I want to say thank you with much gratitude to our panelists for joining us today and sharing their expertise and experiences. I hope you found it valuable. Thank you all for joining the conversation today. We had over 250 registered participants. We would love for you to fill in a brief electronic survey that you'll receive after today's event to share your feedback with us. We take that feedback very seriously. It means a lot to us. Again, the report will be released this summer. To access the recording of the webinar and to download the slides, please look at FSG's webpage, and that will be available in 24 to 48 hours. And another thing is the panelists have generously offered to answer additional questions on one of our blogs at FSG, the Strategic Evaluation blog. So you can check our blog sites and check that out in the next few weeks, and maybe you'll have some of your other questions, because we had close to, I think, 100 questions asked, and obviously not enough time to answer them all. For more information, feel free to visit us at our website, fsg.org. So that's a wrap, and thank you, everyone. Have a wonderful rest of the day. Bye-bye.